NNLM watermark in the top right-hand corner. Aerial footage of a lake and farmland, a herd of cattle, and a field dotted with hay bales. Text: Pottsboro, Texas. Oil pump dips slowly in a field. A water tower reads Pottsboro Cardinals with a picture of a cardinal to the right of the text. There are rural streets and the Cardinals football stadium. Dianne Connery, Director, Pottsboro Library.
In Pottsboro, Texas, a rural community 90 miles north of Dallas, people have to travel to get to the doctor, and that's difficult for a lot of people here, and it's time-consuming. There's no public transportation, nor is there any ride-sharing available.
A one-story brick building. Text: Pottsboro Area Library. Two young children sitting at computers. An older woman speaking with Dianne.
So we stayed open throughout the pandemic so people could come here because people didn't have computers or internet subscriptions at home. Then we started getting a couple calls from people who wanted to have doctor's appointments. Libraries are perfectly positioned to work with telehealth because we're oftentimes the fastest internet connection in town. People trust librarians. It's a neutral space. We're accustomed to helping people with digital literacy skills.
A sign on the library building reads, "Need internet or computer help? Digital navigators."
So it all came together to request funding to start a virtual health room here.
Brian Leaf, Executive Director, NNLM, Region 3.
The original proposal that they pitched was to create a pilot telehealth site that would allow them to figure out best practices that they could distribute as a model to other libraries or other community organizations that are looking to do the same thing.
A woman in a white lab coat speaks with a man on a web camera.
And in that respect, it has been a resounding success.
A building with a sign, the University of North Texas Health Science Center, Fort Worth.
A crucial partner in this was also HSC Health, which is sort of the clinical support that they got for managing schedules, for setting up appointments with providers.
Jessica Rangel, NSRN FNAP, Executive Vice President of Health Systems, the Health Science Center at Fort Worth.
So as it stands right now, there are 77 counties that don't have a hospital. Telemedicine can be a real solution to a lot of these problems if we have both the equipment, and then you have to have someone special there to help lead the way and to acknowledge that it's actually safe.
Shot of the telehealth room. A small room with sound paneling, a computer with a webcam, additional lighting, medical equipment like scales, thermometers, and blood pressure cuffs.
NNLM made it possible for us to convert this old storage room filled with old books into a virtual health room, a room where people can come in, connect with healthcare providers, get the care they need closer to home. It's leading to people being healthier.
A white car parks in front of a sign. Pottsboro telemedicine parking. A woman signs in on an iPad at the back door of the library. The woman enters the telehealth room and talks to a female doctor via the computer. Jamie Kimberlin, Pottsboro resident.
During COVID, I did not want to go sit in a doctor's office and expose myself to bigger things when I just had a minor health issue. So this made it where my safety came first, and it was private, easy, convenient. That's why I chose it.
It's a great model, and in fact, we've created a playbook because this is not about secret sauce. This is about, let's make our communities healthier. Here's what we learned from this experience, and here's what we wish we had done a little bit differently. How fabulous would it be if all rural communities had this kind of access? Healthy people become healthy communities.
Whenever Pottsboro, Texas is on national news, I know we've done something worthwhile.
A sign in the library reads, "Best Small Libraries in America, Top 3, Pottsboro."
And I am proud of being the first pioneer to do this, to be able to help other libraries across the country make this happen. And it's a reality now that would not have happened without NNLM.
Gray and blue NIH National Library of Medicine, network of the National Library of Medicine logo.